Good morning, Doc.
So,
My name
we're
is
already
Kuya
determined the
Parmasan. For
pedal
today, I
box.
will
So,
be demonstrating
now we're
the
going
Leopold's
to
maneuver. So, first thing we're going to do is we're going to wash our hand and
And then
perform the hand hygiene. Avoid the risk of infection for hygienic purposes.
Now we're going to check for the fetal heartbeat.
And then after is we're going to identify our patient, introduce ourselves, and then explain the procedure. So, yung mga may buntag, ako dahil si Kuya Hermosa. Pwede na kami wakon sa inyong name and when is ang birthday.
Favor in March 29, 1982.
So, atong button run is kaya mag-Leopold's maneuver ta para ma-determine natin if asa na ang position sa inyong baby.
Okay.
And then after that, we're going to assess our patient in recumbent position with the knees flexed together, flex. And then after is make sure to give our patient for privacy. Then we're going also to ask the patient if they wanted to urinate. So ma'am, nakafeel ba kayo or?
For 1 minute.
Okay.
And then after that is we're going to make sure to warm our hands before doing palpating and use our palmar surface, not the fingers. So we're going to measure the fundal height of the mother using our which is mother. So open mo trying to measure it from the pubic bone to the fingers. So the centimeter is 31 centimeters. And then after that is we're going to start the first maneuver, which is we're going to determine the presentation. So we're going to stand at the side of the mother, facing our mother, and we're going to palpate the fundus and determine which part of the baby lines at the upper fundus according to its relative consistency, the shape, and then the mobility.
Move on to the fourth maneuver. It is to determine the attitude. Third maneuver, which is determine the engagement. So using the thumb and the fingers, we're going to grasp the lower part of the fundus.
So upon doing the maneuver, the baby's part are not really palpable at the fundus. So the baby must be floating or maybe in a transverse position. So then we're going to move at the second maneuver. We're going to determine the fetal bank. Then first is we're going to place our palmar surface at the both sides of the abdomen, and then we're going to palpate it. We're going to put gentle pressure, and then we're going to palpate it in a circular motion. One side of the uterus at the
First is we're going to stay at the patient's side, facing that lion's feet. So we're going to use the 3 fingers from the internal ligament to the pubic. Soft siya, wala pa na ang baby. Then, we're going to document the
Transfer.
wala yung feel din.
So as per checking, we're right. The baby's in a transferred position. So I can feel the baby's back in here since the baby's head is in here. Then after is we're going to check the pulse rate of the baby, basically for a whole minute. For a normal beats per minute of the baby is 100 to 160 beats per minute. So akong open na.
Di mo. Ito na doon ka.
Pangita araw ko Si Flores. Flores.
After a minute, we're not really got to hear. We're using our stethoscope. We're going to use coupler. Since the fetal bag is, the baby is in a transverse position. So, so we're going to move the third maneuver. We're going to grab the patient's third segment using our thumbs. So, make sure to move side to side.
Heartbeat? Kilay heartbeat?
Dili siya madunggan
Di
using
kayo
this.
appeal?
Kan miss using the batnid ang Doppler miss.
Tajud mo yun.
Okay. So after palpating, I really can feel the bebes in the baby's head, which means the baby is not still unengaged. And then the fourth maneuver is we're going to check for the attitude. So we're going to face our client, face the client's feet, and we're going to use our fingers. We're going to start from the inguinal ligament down to the birth canal of the muscle. I'm going to use. So upon completing, since the baby is still not engaged, we can really say that the hand baby is at the birth canal of the mother. And after all the procedure, we're going to document our findings and our